This scenario involves a nurse practitioner and social worker collaborating to educate an older man and his adult children about the need to consider giving up driving due to evidence of cognitive impairment. The scene starts as nurse practitioner Ashley is finishing the patient's physical examination.
Thank you, Mr. Scott, for allowing me to complete my physical examination.
You're welcome.
Your neurological exam is negative, which means you haven't experienced a significant head injury.
That's good.
The cuts on your body are minor, so once we're finished talking, I'm going to have the nurse come in and bandage you up.
Thank you. I told those guys that brought me here it was a waste of time, but they made me come in anyway.
I'm sorry you have to be here, Mr. Scott. I just have a couple more questions for you. Can you let me know what happened in the accident?
I don't understand the big deal. I've never been in one accident before in my entire life.
Well, that's good.
Even when I drove a jitney around the city for a few months back in my ill-spent youth.
A jitney?
That's what they used to call a private taxi. What do you kids call it nowadays? Uber?
Uber.
Right. One of my kids keeps trying to get me to use that on the phone they gave me last Christmas.
Jitney, I've never heard that term before. You learn something new every day.
Well, anyway, I've been going to the same dentist for years, but they moved all the street signs around.
So you got into your accident on the way to the dentist?
Dentist? I wasn't going to the dentist. Who said anything about a dentist? I was going to the post office, but I've gone to the same one for years, and well, now they moved all the street signs behind trees. Well, I made a wrong turn. When I went to turn around, this car just ran into me out of nowhere. Glass everywhere.
That sounds pretty jarring.
Those policemen are blaming me because I'm an old man. Well, they can't do that. It's not fair to blame me just because I'm old.
I'm sorry about that, Mr. Scott. Thank you for sharing that information with me. It's helpful. I'd like to do one more test, something called the mini-cog, and it tests your thinking. It's a pretty standard procedure. It might sound a little bit silly, but it's really helpful to us. Is that okay?
Well, sure, I don't mind a little silly.
All right. I'd like to say 3 objects if you can repeat them for me, and remember them for later. Nickel, pony, and chair.
Nickel, pony, and chair.
Great. Now I would like for you to draw a clock face. On the clock face, I like for you to draw 2 hands so that the clock says 10 minutes until 11. Great. Now can you repeat those 3 objects you said to me before?
3 words. 3 words. One was pony. The other was something with money, and I can't remember the other one.
That's all right, Mr. Scott. From the results of this test, it's showing that you're having some issues with your memory. Your neurological exam was negative, so I don't think that you've had a significant brain injury.
Brass tacks, sweetie. What are you trying to tell me?
Fair enough. I believe that you have some mild cognitive impairment, which could pose a safety risk to you driving.
Well, if you're trying to tell me I can't drive anymore, you can forget it.
I'd like to consult with one of my colleagues, if that's all right with you, so that we can get some options to keep you safe. Is that all right?
Fine, fine. As long as they don't try to take away my keys.
All right, I'm going to go consult with our clinical social worker, and we both will be back to discuss with you. Hi, Deb. Do you have time to talk to the patient in cubicle 1?
Sure.
I'd like to have a conversation with him and his family about taking away the keys. And I was wondering if you could provide them with some driving alternatives.
Well, I'm happy to help. Now, are you ordering a driving assessment? That's such a great way to determine if it's safe for him to drive or not.
Can't we just have the family take away his keys?
I understand why you're concerned.
But
There's a couple of reasons why we might want to handle this differently.
what are those?
Well, from what you've told me, there are clearly risk factors related to his driving. But neither of us has the expertise to perform a proper evaluation. That's the role of an occupational therapist who specializes in driving assessments.
That's a good idea.
More importantly, giving up driving is a difficult transition for an older person and their family. We really need to try to break this down into manageable steps.
I agree. It's difficult for patients and families when you talk about taking away the keys. I really could use your expertise when speaking with them. Do you have time to talk with them now?
Of course, a team effort really is the best way to handle this type of situation.
I agree. Hello, Mr. Scott. This is Deborah. She's our unit social worker and an expert in community resources like driving alternatives until we get you driving again.
Well, what do you mean until I start driving again? I'm driving home today.
You're comfortable driving, Mr. Scott?
I've been driving since I was a kid. I drove an ambulance, delivery trucks, you name it, I drove it. And I never had an accident in my whole life.
What brought you in here today?
Well, you can't blame me for that. That car came out of nowhere.
I understand. Sometimes after a car accident, healthcare providers recommend that a patient consult with their primary care provider just to make sure that there's nothing going on medically that might interfere with their ability to drive safely.
I'm fine, I tell you, fine. I want to drive. I'm going to drive.
Deb and I understand how important driving is to you. We also have a driving assessment clinic here in the hospital if you'd prefer that to going to see your primary care provider.
Well, seems like you're trying to jam me up.
I'm sorry, Mr. Scott. We just want to make sure that you're safe before you get back behind the wheel.
Hypothetically, if you weren't able to drive for a while, who would help you get around?
My kids. They're here now.
Would it be all right if I spoke with them?
They signed a HIPAA release.
In this case, considering how important driving is to Mr. Scott, I just want to make sure it's all right with him before I speak with his family.
Yes, talk to them, but tell them they can't take my keys away from me. I'm in charge.
I will be sure to remind them how important driving is to you, Mr. Scott. Thank you so much for talking with me today. Hi, Lynn and Joe. I'm Deb. I'm a social worker here at the hospital. Nurse practitioner Ashley asked me to speak with you about your dad's driving because she's concerned about his safety, and I often help families deal with this kind of issue.
Dad's driving is fine. Besides, we were raised to respect our elders. It's not like we can just say, oh, hey, Pop, no more driving.
I understand how challenging that could be. But nurse practitioner Ashley came to me because the circumstances of your father's accident and his score on a memory test that she gave him led her to believe that it may not be safe for him to be driving.
You're the professionals. Can't you take away his keys?
What? We can't do that. I mean, how's he going to get around? He goes to church 3-4 times a week to light candles for Mom. You want to take that away from him?
It varies by jurisdiction, but in this case, neither nurse practitioner Ashley nor I have the authority to just take his keys. Let's talk about some other options.
We have to do something, Joey. I've been really worried about this. What if he hurts himself? What if he hurts somebody else?
Both of you are raising important concerns. It may be time for him to stop driving, but that would be very difficult for him and for both of you as well.
I just don't see this working.
Before the accident, did either of you notice any problems with his driving?
He has scratches and dents on his car. I was driving with him last week, and it was really harrowing. He forgot how to get home.
What? You never told me that. I mean, I went to church with him last week, and he was fine.
I didn't tell you because I knew you'd say I was exaggerating, and it would just start a fight.
Well, you are exaggerating.
How can you say that? Look at where we are now.
I know this is very difficult to talk about, and it seems like each of you have had different experiences with his driving recently. What about his memory?
His memory is fine. This is normal. I mean, who doesn't forget things?
Well, nurse practitioner Ashley feels that his memory issues justify a visit to his primary care provider to consult about getting a full workup for dementia.
He should go see Dr. Smith. Could he tell us if he has Alzheimer's? Is that what this is? Is it Alzheimer's?
I can't make a diagnosis. He is showing warning signs of dementia, and Alzheimer's is a type of dementia. He'll need additional tests. Nurse practitioner Ashley will provide you with more information on that before you leave today. Now, as for his driving, we have a driving assessment clinic right here at the hospital. An occupational therapist with specialized training can evaluate whether or not he can drive safely.
Well, I hope you don't expect us to talk to him about this.
Who does your dad listen to?
He might listen to Dr. Smith.
Yeah, I think so.
Well, in that case, it might be best for Dr. Smith to talk with him about the driving assessment. And I would suggest you contact Dr. Smith prior to the appointment to update him about the situation. I've found that to work well in similar situations.
Clearly, I agree with you, but how are we going to do this? We both have jobs, kids.
Yeah, I know. This is a lot to deal with.
Yeah.
I have some resources here that I hope will be helpful to you. One thing I've included is a very good booklet on driving and memory loss. You may find it helpful to refer to that later.
Thank you.
Now, I've also included information about a senior service agency near where your dad lives.
And what do they do there?
They should be able to send a care manager out to his home to talk with all of you about the various services that may be available to him, such as transportation to the doctor's office or even to church. Now, I've also included a list of caregiver support groups in your area.
Caregivers? It's not like we're dressing him.
Well, if he's not remembering things, who else is going to help him?
Well, caregiver support groups are for family members taking care of loved ones, and that might be something like dressing and bathing. But helping with transportation or working through a difficult decision like we are right now are both aspects of caregiving. As things change for you and your dad, you both might benefit from that kind of support. It really helps to talk with other people who are going through similar experiences.
Thank you. What do we do now?
I'm going to go tell nurse practitioner Ashley about the plan to coordinate the driving assessment with Dr. Smith. Then she'll complete the discharge paperwork. And in the meantime, we're both available if either of you has any more questions.
Thank you.
Thank you.